they should do all this investigation once in a year. Like we celebrate our birthday once in a year, we should do the checkup the day before the celebration of the birthday, and let's hope that the all reports are normal. But many people neglect the early warning symptoms, like a swelling, anywhere swelling which is painless. It should be shown first to the doctor. People show the painful swelling, not the painless swelling. That's why any swelling anywhere in the body which is painless should be shown immediately and found out what is the problem, what is the swelling is.
We are thankful to Garud Hospitals and Ahmednagar Super Speciality Cancer Center at Ahmednagar, which is a recognized name in patient care. Garud Hospitals is under kind supervision of Dr. Prakash Garud. He is an ex-Tata Memorial Hospital, MS Mumbai and FICS Oncology. सर आपका बहुत बहुत स्वागत है हमारे शो पर.
Thank you.
सो काइंड ऑफ यू कि आप अपने इतने बिजी शेड्यूल से हमारे लिए टाइम निकाल के लेकर आए.
It's important for you
यस
guys,
यस
for
सर.
all of us. Yeah.
जी. Hello and welcome to Rabbi Rashi Foundation. Dr. Prakash Garud has an excellent experience and very helpful soul, especially for the cancer patients. Dr. Saab, to start with, I would want you to tell us your journey. आपने ये हॉस्पिटल बनाया है, इसका देख-रेख कर रहे हैं. How did it happen? And why you did it Ahmednagar में जाके, especially you are from Bombay.
Yeah, nice. A good question. I studied in Mumbai, Grand Medical College, Age Hospital, my MBBS and MS. And then I was selected in Tata Memorial for the cancer surgery super specialty. So I did cancer surgery in Tata Memorial. Now, later on, I thought that I am from Ahmednagar district, in a rural area. I'm from farmer's son. So I decided to come to Ahmednagar only because to give services to the all the rural population here, because they have to go to the metropolitan cities and spend a lot of money for a treatment. So instead, if we started a center here, it will be beneficial for those people, and all the lives will be saved of cancer. That's why we started this center in 1996 at this place, and we are doing excellently, like all cancer operations, all cancer chemotherapy, and all cancer radiotherapy. Everything we do it here. That has helped people very well, because the cancer is increasing, and because the people do not have an access to the metropolitan cities, neither they had money to go to the metropolitan cities to spend for a cancer treatment. So here we started the center. At the same time, the government scheme also has come, like a state government scheme, Maharashtra state government scheme, and the central government state government scheme. There are different insurance companies are there. So all these has helped people to complete the treatment, cancer treatment, because cancer treatment involves a little lengthy treatment, like operation, cancer chemotherapy, cancer radiation. So it takes time, and it's a lot of expenditure is involved if one goes to the metropolitan cities. This all is avoided by starting the center in rural population, a rural area like Ahmednagar district. And yet it has helped not only the Ahmednagar district, but also the surrounding districts and rural population of the entire Maharashtra. So we are very happy that we have started this center at this place. And now our center we are doing all the cancer surgeries, all super major cancer surgeries, all the cancer chemotherapies, and all the cancer radiotherapies. And we have advanced technology, like in surgery, in chemotherapy, in radiation also. We have all the advanced technology. So whatever is available in metropolitan cities is available here. We have the best radiotherapy machine here at our place, which is recognized all over the world. So this has made the patient's life more safer, and help them to fight the cancer disease.
I think that is a real I think more than just being a doctor, you are a noble soul. Ki you've been, helping people so much in the rural area. Okay, sir, coming back to this, a lot of people have a lot of misconceptions about cancer. Okay, they feel that, you know, uh, if they're eating wrong, they get cancer. They're thinking wrong, they get cancer. For example, let us talk on a case study. Somebody is just diagnosed with cancer. What is the first step a person should take? Tell us about that.
Yeah, regular checkup is very important in everybody's life. See, after 20 years or 25 years, everyone should get the regular checkup done from our family doctor or whichever consultant they want. Do all the routine checkup like blood test, then the X-rays chest, sonography of the abdomen, all these tests, and whatever symptoms, whatever problems they have, they should tell. Once they do this, there is a early diagnosis of the cancer, very early diagnosis. Because even if there are no complaints, they should do the all this investigation once in a year. Like we celebrate our birthday once in a year, we should do the checkup the day before the celebration of the birthday, and let's hope that the all reports are normal. Even if there is something is there, then the consultants help is needed to diagnose and finalize the diagnosis, and accordingly the treatment is avoided. Treatment is given with the in early stages, very early stages. So cancer is curable in a very early stages. With first, second, there are four stages: stage one, stage two, three, and four. First and second stage are curable cancers, so it should be diagnosed as early as possible. But many people neglect the early warning symptoms, like like a swelling, anywhere swelling which is painless. It should be shown first to the doctor. People show the painful swelling, not the painless swelling. That's why any swelling anywhere in the body which is painless should be shown immediately and found out what is the problem, what is the swelling is related to. Second, no pain, but there is a bleeding in the sputum, bleeding in the urine, bleeding in the stool, should be checked up. Even if there is no pain, should be checked and related investigation should be carried out. So that diagnosis many diseases like oral cancer, then the lung cancer, and then the intestinal cancer, all these are diagnosed. And again, if there are no symptoms but weight is decreasing, the appetite is decreasing, then also the test should be done. Irrespective of not in once year, whenever these symptoms appear, they should do the test so that early diagnosis of the cancer is done. We had many patients. We came very early and got cured, and the problem is over. There are many other diseases which cannot be cured, like blood pressure, then the diabetes. These are some of the diseases which we have to take treatment throughout the life. But in cancer, if diagnosed early and treated properly, patient gets cured and don't have to take any treatment throughout the life. And same thing, if they are diagnosed very late, like in third or fourth stages, then the survival is compromised. Survival is not definite, which very much reduced. Like in first stages, almost 90% survival is there. In the second stage, it comes to 60 to 70% survival. In third stage, it goes to 30 to 40%. And in fourth stage, it goes to almost 5% survival. So, these staging, the diagnosed stage of the diagnosis is very important to decide the treatment, to take the treatment, and the prognosis of the case. So, these are the early warning symptoms we should not neglect. Many patients come to us with the advanced disease. They said there was a small ulcer. I thought it's a stomatitis, so I kept on working, and that's why. And then it goes on increasing. The etiological factors are very important. Nowadays, cancer is increasing very fast, and in most of the though accident is a number one, heart is a number two disease cause of death, but third is cancer, but is trying to come to the second or first step in the cause of the death. Why? Because there are many reasons like habits in India. Lot of addictions are there. Lot of addictions like tobacco and tobacco related products, then mawa, gutka, then the alcohol, smoking, bidi, cigarette, all those things. These are very causative factors. They are definite causative factors of the cancer. And 50% of the patients, cancer patients in India, are because of this addiction. So that we can avoid. That is one thing. Secondly, the another cause, important cause, is a diet. Very important diet. Very spicy diet. Then a very oily diet, and outside diet, like outside we keep on eating all the time. That is also not good because there are a lot of chemicals being used in the diet for the taste purposes. So these are all the important factors. Another important thing is lack of exercise. The exercise increases the uh, preventability of the cancer. It increases the power of resistance of cancer in the body. So exercise also is very important. Regular exercises, proper diet, and avoiding of the all the addictions is very important in prevention of the diagnosis. So the but all these are the factors we are concerned with the increased number of cancer patients in India. Rather, all over the world, this is the scenario.
So this is a great takeaway that if you're having a bad lifestyle, bad
Mm,
food, and not taking care of your health,
mm.
it can lead, to
Yes,
cancer. And I
yes.
think that's what Dr. Garud is trying to tell us. Okay, so you've made this hospital in Ahmednagar in Maharashtra, and you are serving worldwide, right? You have patients
Yeah.
coming from all over the world to you.
Yes, yes, yes.
Okay, so what kind of team do you have, sir? Let's hear.
See, I am myself is a oncosurgeon. I do all the surgeries, right from head to toe. Cancer related to cancer, I do it. Then we have a radiation oncologist, Dr. Manoj Birazar, who is from AIMS. So he's full time working here. Then Dr. Padmaja Garud, she's here. She's a gynecologist and a ladies cancer specialist. So she's all the ladies cancer she handle very well. And we have a medical oncologist, like cancer chemotherapy specialist, is there, Dr. Tushar Mule and Mangesh Meka. They are also one of our team members. So all these team members various because there are three important treatments in cancer. One is operation, second is cancer chemotherapy, and a third is the radiation. So all the specialties are available here, and that's why we give the best possible treatment to the patient as the world standard treatment.
So you had initially just told us that it's a long treatment.
Yeah,
People have to come
yeah,
and.
yeah,
So do
yeah.
you have all those facilities of people staying over there for a longer?
Yes, we have. We have pre-beds also here available at our premises, so that suppose patient is very from a very long place, then he has to take treatment daily, like radiotherapy, daily treatment. So we have made a pre-beds available here for their stay, and nearby patients they come from home and take the treatment. And long distance patients, if they have a long date, then naturally they can go home and come back for the treatment. So all these facilities are here, and that's why patients are very much benefited in treatment. In our team, Dr. Yogesh Garud also is joining shortly. He's doing his MCH in cancer surgery in AIMS, Bhubaneswar. So once he finishes, he also is going to join it here.
Okay, so sir, initially you had just told us that that if cancer is detected earlier, it
Ah,
can be treated. Now,
correct.
many times we hear that a patient who could not be diagnosed but is a fourth stage, cancer
Ah,
patient.
ah.
So why does that happen and how does it happen?
It see, there are patient factors also. Patient neglect the early warning symptoms. They neglect it. First thing, they don't go to the doctor immediately with the early warning symptoms, and that's why cancer keep on increasing. Cancer has a property. Once it is started in the body with one cell, it goes on dividing and goes on increasing in size. And when it increases in size, then it produces definitive symptoms. In early stages, there are no definitive symptoms. I told you the early warning signals. Those are very important. People should be aware of that. We take a lot of awareness, cancer awareness camps, and tell them what are the early warning symptoms. That is very important. So if that is done, then patients that can be diagnosed early. But because the early warning symptoms are neglected by patient, they don't go to the doctor, and that's why many times they come very late to the doctor, and that's why many patients meet us in the advanced stage. And as I told, in advanced stage, the treatment is there, but the treatment is palliation. Palliation in the sense to reduce the trouble, to reduce the symptoms, and make the life comfortable. That is the idea. Of course, little bit life may be increased with the treatment, but then in the last stage, there is no definite cure for the cancer in the last stage.
So I want to ask you, Dr. Garud, that you have been repeatedly saying that people ignore the early symptoms.
Correct.
Now, are the initial tests or diagnosis of cancer expensive? What is the reason? Is it human mindset? Because it's so there is a lot of awareness about cancer. Okay.
Uh,
But people still ignore. What is the reason for that? Is it the mindset?
Fear. Fear also is one of the cause. Fear is a cause. Fear means, so they don't want their diagnosis made as a cancer. That is also one of the causes fear. And early warning symptoms are not very troublesome. They are early warning symptoms. They are not troublesome. That's why people try to tolerate them on body and carry with the life. That is the problem. And when they come to doctor, when there are severe symptoms are there, cannot tolerate them, then they come to the doctor. That is the reason why early diagnosis is very less. But what I told you is solution, simple solution. Before every birthday celebration, do a general test, general carry out general test, and early diagnosis of the cancer may be made if it is there. Simple solution.
Okay, so what? So are you saying the regular tests are the normal blood tests? Is it?
Yeah,
Or
blood,
there is.
normal blood tests are there. There are some special tests are there according to symptoms. Because many blood tests are there, they diagnose the specific cancer, like cancer of the ovary in female, the cancer of the pancreas, cancer of the other sides of the body. So there are tumor markers in the blood test, but they are done when they are suspected. Otherwise, routine tests are very important. Routine tests also important, so that we come to know whether the blood is normal. If it is not normal, if it is going down, why it is going down, then the further test can be made. And as per the symptoms, that other further tests can be made. This is in blood test, what I'm saying. But other tests are simple X-ray test, simple. Then sonography of the abdomen, simple test. These are the commonest tests, and telling our doctor what are the problems. Telling, because doctor's inspection and his palpation, that is by touching that part of the body, is very important. Then they feel, the consultants always feel the of the tumor is there. Feel is very important. The inspection is very important. So even if patient don't have symptoms or little bit very early symptoms, they should tell our doctor, so that cancer can be diagnosed very early.
Okay, so what has been the changes in the advancements in the treatments? There are every day there are new machines coming up, new
uh,
medicines coming up. So what
uh,
is your take on that?
yeah, we do latest whatever available. We have a tumor board meetings here every month here. So tumor board meeting, whatever latest available for sake of the surgery. Suppose how can we preserve the maximum part of the body, and how we can do the reconstructive, that is the plastic surgery part, and make the functioning part better. That also there is the improvement is there. Secondly, chemotherapy. No new drugs are there, so we always in contact with these drugs, and we have tumor board, so updates is always there. There are many changes over the years now. Last 25, 30 years, there are many changes. Many good drugs has come, which are the less side effects and more effects. So those drugs we are using the latest, whatever possible, and whatever should be affordable to the patient. That is also very important. So that also we use. And immunity has come, then immunotherapy. So those are also drugs we use, but little bit they are still costly. So sometimes they use those people who are affording them. Then the radiation. radiation. Before there was a cobalt, now there is a linear accelerator, and we have the latest world's best linear accelerator here. So the side effects of the radiotherapy has reduced much, and now radiotherapy has become more specific, less side effects, and more effective in the treatment. So these are the changes are going to take are taking in place in cancer treatment. I think the in the world over, maximum research in going in cancer, because it is threatening the entire world. That's why research is there, and we keep ourselves update in the treatment part of it.
So I see, Dr. Garud, you work, I think, almost 20 hours a day. Because whenever we are trying to get in touch, they say that you're doing a surgery early morning or something because of, so many patients. Now
Yeah.
you tell me, when you had started with this journey of the Garud hospitals and
Ah.
convincing patients, what were the challenges and what solutions you provided to all those patients?
Yeah. Challenges with the patients were that the cost of the treatment. First thing, cost is very high in cancer. Otherwise, but the solution was there. Then government schemes like Maharashtra state government and central government schemes we are using. Patient getting free treatment at our center under the scheme. Like more than 30,000 free treatments were given under this scheme to the patients, so that the survival rate has increased in this area about the cancer. And we keep on taking the awareness programs, the early cancer diagnostic camps also. So in that there is awareness, and that makes the people aware about the cancer. So ignorance was very much more in the rural population rather in urban population also. So we had to take an effort to make them aware about this disease, and make them aware about the early warning symptoms, and that's why the people started responding, and they got benefited also in this over the period. And other things is cost also reduced because of the schemes. Now they're getting, many of them getting free treatment. There are insurance, so we recommend them to get the insurance done for the health insurance, so that also cost also is reduced. And again, the addictions is much more in all the rural areas and everywhere in India. So that also I have told them to prevent the addiction, so that your cancer can be prevented to some extent. So like that. So these are were the challenges, though the rural area, but many people helped us. People from Tata Memorial, Dr. Shona Nag used to come here. Then the doctor, the other people also came from Mumbai, from Tata, because I was there. No, my colleagues used to come here. Director, Tata director, R.S. Rao, who inaugurated our center at Ahmednagar. He's a director of the Tata Memorial Center. And Dr. Rajendra Badwe, who was just director of the Tata Memorial Center, we worked together. He was my colleague. We were together, we did residency in Tata Memorial. So he also came here for the awareness programs whenever we had this. So he got a Padma Shri award for that. And we have got many awards also at our center because of the work that we are doing for the betterment of the cancer awareness and cancer treatment at this center.
So what has been your success mantra? Like, you're so positive, but you are with so many patients all the time. What
Ah.
keeps you stress free? Let's hear.
Trust me, because I think about the other people only. Make them, I feel that is my work, that is my duty to make the people survive of cancer. That is the only motive that I have. And that's why I keep working for it. I do exercise myself daily. I keep myself fit, and no addiction. Of course, I keep advising other people, so I cannot do addiction here. So that's why no addiction, regular exercise, regular diet. Outside food is minimal. I avoid outside food also. So and I like working all the time. Working is my pleasure. That is I enjoy it, and that's why we are working very hard.
And that, of course, we know, and it is a great takeaway. Keep positive, be positive, think for others, give back to the society, and that will keep you cancer free also. Okay, coming to this, What is that one food you want to recommend to all our listeners to avoid? Let's say.
One food. Means, see, outside food usually from the hotels, usually they mix up many chemicals because of the tip or the taste, and that's why they may be dangerous. That is the one thing that is. And another is spicy and oily food. That also I tell the people not to take spicy and oily because they are not good for the health. So this should be avoided. Once they are, and all addictions should be avoided. Addictions, of course, should not be there.
So, a lot of websites say that sugar is very bad, it increases cancer. Is it?
No, no, no. Sugar is bad for a diabetic patient. Should, diabetic patient he cannot should not take sugar at all. Diabetes. But otherwise, if there is no diabetes, sugar is not a bad. The sugar is means of course everything should be under control. In controlled sugar, you can definitely utilize if you have no diabetes and if you do exercise. Exercise is very important. If you exercise, naturally we digest everything properly. So little bit sugar is no problem. Sugar is not that bad. Sugar is not carcinogenic. It is only uh, problematic for the patient who has diabetes.
Okay. So, what is your last one message to all the brands and communities and people out there?
Yeah, I tell them that don't get afraid of a cancer. First thing, and do the remember the early warning symptoms and get checked every year before your birthday for the routine tests, which will diagnose many diseases like diabetes, blood pressure, and also cancer. So do that. Have an active life. Have a exercise. Have a good diet and enjoy the life.
It's about journey onto the fight and not fright. There is a lot of hope out there. Get in touch with Dr. Prakash Garud. Garud Hospital details are available on the podcast. Their team is available 24 by 7. Speak to them. Even if you want consultation, they will definitely help you out. Dr. Saab, आपका बहुत बहुत thank you है कि आपने.
Thank you.
Thank you.
I felt energized and empowered with the interview.
Thank you.